跟Jalloh阁下发表致辞，掌声欢迎。
Your Excellency, the Vice Premier of the People's Republic of China, His Excellency VLiu Guozhong, honorable ministers, distinguished delegates, esteemed delegates of the Vice Premier's visit, distinguished ladies and gentlemen, today we gathered here in solemn remembrance of a moment in our history that tested the very fabric of our nation. The Ebola outbreak of 2014 was one of the most painful chapters Sierra Leone has ever lived through. It challenged our institutions, our health system, and our collective resilience as a people. But we also remember that Sierra Leone faced that crisis with courage, leadership, and resolve. Our doctors, nurses, burial teams, community leaders, and citizens stood at the front lines of the response. Many paid the highest price, and today we honor them. In that moment, Sierra Leone led, and our partners stood with us. We acknowledge with appreciation that the People's Republic of China was among the first partners to respond quickly and decisively. China helped to establish treatment capacity at a critical time and deploy medical professionals who work side by side with our own. We remain, as a country and as a nation, forever grateful for this solidarity during a moment of sheer vulnerability. However, the true significance of the Ebola outbreak lies not only in how we responded, but in what we built afterward. Today, we strengthen our legal foundations and established a permanent national public health leadership structure through the creation of the National Public Health Agency, ensuring that Sierra Leone can detect threats early, coordinate responses, and protect routine health services even in moments of crisis. These reforms were not symbolic. They reshape how our nation protects its own people. Today, Sierra Leone has robust laboratory capacity that did not exist 10 years ago. We can now diagnose more than 10 epidemic-prone diseases, from Ebola and Marburg to COVID-19, cholera, yellow fever, and influenza within our own borders. This infrastructure is now part of who we are, not emergency scaffolding, but permanent national capability. The Sierra Leone Surge Personnel Deployment Plan now ensures that our country can mobilize trained responders rapidly across district and beyond our borders when needed. It reflects our core lesson. Preparedness is not an event, it is a system. These reforms were not theoretical. They have been tested and they have held. Over the past 2 years alone, our country has led responses to the Mpox outbreak and the current push public health emergency, while also investigating and ruling out multiple other suspected epidemic threats through strengthened surveillance and laboratory testing. In 2024, Sierra Leone demonstrated continental health leadership when we deployed 20 of our own medical professionals to Rwanda to support the Marburg outbreak response. This provided clinical care, training, and epidemic control support, drawing directly from the expertise we built through the hard experience. This was not just an act of solidarity, it was a proof that Sierra Leone now contributes to global health security, not only receive it. This is what partnerships should mean. Standing together in crisis and growing stronger afterward. Our cooperation with China has evolved in the same spirit, from emergency response to system building to the strengthening of long-term health security infrastructure. Today, the capacities established at the China-Sierra Leone Friendship Hospital in Juldeh and at the Infectious Disease Prevention and Control Center at 34 Military Hospital have been integrated into our national preparedness and response system under the National Public Health Agency. This is how development cooperation should work, strengthening national institutions, not substituting for them. As we mark 10 years since Ebola, our message is one of mutual respect, shared learning, and forward-looking collaboration. Looking ahead, Sierra Leone and China have the opportunity to deepen cooperation in the area of workforce training and exchange, laboratory and genomic surveillance, technology for epidemic intelligence, and continued investment in resilient public health systems. Our partnership is strongest when we support Sierra Leone's priorities, capabilities, and leadership. Excellencies, friends, we cannot change the past, but we can choose what the past teaches us. Ebola taught us that health security is national security. It taught us that no nation stands alone, and it taught us that solidarity must be matched by responsibility, preparedness, and continuous improvement. Today, we honor those we lost. We also honor what they left us. A responsibility to build a safer and stronger, more resilient Sierra Leone. Distinguished ladies and gentlemen, on behalf of His Excellency the President, the government and the people of Sierra Leone, we want to thank the government and the People's Republic of China for the sustained support to our country over the years. This no doubt laid the basis for future cooperation. His Excellency, I also take good note of Vice Premier Guozhong 3 points: that China's further cooperation and investment in Chinese medical centers for rural support, strengthening early warning and monitoring capacity, also promoting digital health, human resource training, and health personnel. Your Excellency, at this stage you have laid a very optimistic path for our cooperation between the two countries in the area of health. I want to thank you on behalf of the people of this country. Thank you very much.
Thank you.